With the start of spring and the new school year in March, it's a time when a lot of people, including students and office workers, kick off to a new start. But it's also a time when the body can struggle as it tries to adjust to the new surrounding and environment. Elementary school students who are just starting class begin carrying heavier bags that, if carried incorrectly, can lead to deformations of the spine. And female freshman students who may start to wear high heels for longer hours can stress the spine's facet joints, leading to pressure in the discs. New office workers can also face more back pain, working late-night hours and frequently sitting on the floor for office dinners. If prolonged back pain is left untreated, it can lead to a herniated disc, which protrudes and compresses spinal nerves, causing pain. According to the Health Insurance Review and Assessment Service, over the past 5 years, patients with disc herniations jumped by more than 18%. With those in their 20s and 30s also susceptible to such conditions, back pain has now become a problem found in all age groups. From children to adults, back pain is now a common cause of discomfort. We'll get a look at how to treat it and stay in good shape.
Now, our back is considered the body's pillar, and that's why it's important to keep it in good condition. And to tell us more, we're now joined by Dr. Eun Sang-soo from Urido Hospital. Good morning. Thank you for joining us.
Good morning, Doctor.
Hi.
Good morning.
We all suffer from back pain from time to time. That does not mean we all have herniated discs. What are some of the main classic symptoms?
Okay, this is a spine model, and between the bone there's a soft disc which gives the motions to the spine. And as the central part of disc herniates, it could compress the spinal cord. And the compression of spinal cord, the symptom comes with a radiating pain. So the patient explains the radiating pain as a burning sense, numbness, or some electricity running. So in the cervical disc herniations, the pain comes from the back of shoulder through the arm to the fingers. And the lumbar disc herniation goes through the buttock, thigh, calf, the foot. In the severe cases, patient could not move at all, or it causes a paralysis of the ankle or any joint. And in a really severe cases, it could cause a dysfunction of urination or defecations.
So disc herniation is not just a problem for adults, but a lot of young people, students, are experiencing this as well. And we saw in the report that heavy backpacks was one of the causes. But what could be some of the other causes, and how can we prevent it?
If the children is complaining of back pain, heavy bags may be the reasons. And to wear it in a proper way, you should keep the strap tight so the bag stays on the back and the spine, and it fits well, and then it should be above the waistline. And the weight of the bag should be less than 20% of the child's weight.
And we all wear high heels from time to time. Not young,
Not me.
obviously.
Not him.
But, right, and we do spend a lot of time sitting down in front of our computers. So there is a lot of pressure going into our backs, but we can't avoid that from happening. So what are some of the little tips you can give us to alleviate that pressure on our backs?
Okay, so actually the high heel obviously is bad for the health, but the ladies cannot give up. So the whole body axis, it puts it into the front of the body, so it causes a lot of burden to the forefoot and the spine also. So it is not recommended to wear them for a long time, and it's better to wear the comfortable shoes. And in an office dinner, you get to sit on the floor for a long time. So it's better to stand up in every hour, do some stretching, and lean on the chair or the wall.
Okay, so everything from bad posture to heavy backpacks and high heels, misuse or abuse of heels can actually lead to back problems. So we'll get a look at some of the treatment options out there that are less invasive and a little bit more comfortable.
Herniated disc treatment has become much simpler, sometimes requiring only minimally invasive procedures.
People often tell me that I have bad posture, and recently I've been experiencing back pain when I sit, so that's why I'm at the hospital.
In most cases, you can be diagnosed through a simple X-ray or MRI. Herniated discs mostly occur between the 4th and 5th vertebrae, or the 5th and sacrum, because this area carries much of the body's weight and is moved around a lot. In this case, an endoscopic laser can be used to reshape the disc. Using a thin spinal endoscopy, the problematic area is removed with laser assistance. It preserves the healthy disc tissue, allowing it to provide cushioning. Also, a procedure called CT image-guided spinal microtherapy can be used, allowing the doctor to find a route through stimulations to reduce the time required for the detailed treatment. Epidural neurolysis removes scar tissue around the entrapped nerves and injects medication to reduce pain. Most patients will experience a reduction in pain after such treatments.
What's great about the laser endoscopic treatment is that we're able to remove the fundamental cause just as we would with surgery. And there's no need to go under general anesthesia, only requiring a small incision. The recovery is extremely fast, and the patient is able to return to his or her daily routine very quickly.
So nowadays, people try to stay away from surgery because all of these different less invasive procedures to treat herniated discs. So do the methods differ from the patient's age or gender, perhaps?
Not much with the age or the genders. However, to explain simple, this procedure is done to the patient who the surgery seems too much, but it doesn't get better with the simple injections. Epidural neurolysis, we use these flexible catheters. So we put this into the opening of the sacrum, and between the bone and the neural structures, we make an adhesiolysis, which means we remove the adhesions and put the inject, and this will wash out the inflammatory cytokines and soothe down the inflammation in the nerve. The other procedure they show on the video is a Pellan, that we put this around working channel through the side of the body, and then to remove this herniated disc, we could either remove with laser decompressions or use this forceps to grab it out. Right.
So these procedures are just a one-time event. It takes care of the problem in one treatment, or does it have to be a repeated procedures? I
could not say that it's a definitive treatment that it resolves all the symptoms right away and never comes back. Definite treatment for the spinal stenosis, and this is a surgical decompression. However, if these procedures are done in proper indications, it could be effective as a surgery. And to prolong the treatment effect, it's better to take a sick leave more than a week, even though you can be discharged on the surgery day or the day after. And do not sit on a long time or lift the heavy object.
Okay, well, it seems that whether you have treatment for a herniated disc or whether you don't have a herniated disc, one of the best methods of not getting a herniated disc is prevention. Can you give us some methods, maybe some exercises, perhaps?
Okay. In our hospital, we have a central treatment, which is a 3D stabilization method that strengthens the back and abdominal muscles and surrounding the spine. The lower half of the body is locked, while the machine moves 360 degrees front, back, and sideways to exercise as it is needed. There's also a sling therapy that helps to strengthen muscular power, endurance, and balance. And I would say the best exercise is walking. I tell my patients to walk for more than 30 minutes to an hour every day with running shoes on, fix the time, walk so that it becomes a routine. This will make you feel healthy and stay in shape and lose weight and strengthen your back muscle. And the best key is to have a good posture is the best key to the health of the spine.
I don't know. I underscored running shoes there. No high heels, running shoes when you're walking. All right. Thank you so much, Doctor.
Thank you.
Thank you.